David Levine. Today is April 10th, 2022. I'm in San Diego at the American Association of Plastic Surgeons meeting, and I am interviewing icons for the Icon Project, which essentially is to interview educators, forward thinkers, innovators, people that have made plastic surgery the great profession that it is today. I'm fortunate to interview Dr. Robert Ruberg. Doctor, thank you for coming in.
Thank you for inviting me.
My pleasure, sir. And first thing I start out was real easy. What do you state your full name, date of birth, and something about your father, mother, family, just whatever is comfortable for you.
So, full name Robert Lionel Ruberg. I was born July 22nd, 1941 in Philadelphia. My parents are Yetta and Norman Ruberg. They were teachers in the Philadelphia public school system. I grew up in Philadelphia, and that had an enormous influence on me in a lot of different ways. In that teaching, I have said now, is kind of the family business, and academic pursuits are the family business. And as we may see as we talk, that applies to my children as well. But that's my background, and growing up with people that were involved in education. Other people in the family at that time were also teachers in the public school system or other positions in education at that time.
Nobody medical in your family?
There were medical people. I guess that's a different influence. And my father's brother was a neurosurgeon. He was an interesting man. It's my Uncle Ray, who I guess is probably the most important influence in terms of choosing medicine. He was trained in neurosurgery. He was an osteopathic physician. And at that time, there were no osteopathic physicians doing neurosurgery. And he got training some in allopathic schools, and then had to go to Europe and came back and was very prominent, respected head of the department at the osteopathic school, neurosurgeon. And he was kind of my professional ideal. And so that was an enormous influence in going into medicine.
Do you happen to know which year he went to Europe, what years those were?
No. I'd have to do a little calculation to figure it out.
I'm just trying to figure it was around World War II.
No, it would have been, let's say, so I finished in the 60s. It would have been in the 60s probably.
Oh, okay.
So,
okay.
yes, because so he'd been a physician for a period of time, I think, before he did this training. But I know, I mean, I probably traced through some recollections that I have of other people that met him in his training. But
so the reason I ask is that he obviously had been in practice doing doing osteopathic medicine,
yes,
mostly primary care, I would assume.
Right.
Yeah.
Right. But so then he decided to do neurosurgery. Some of his time was spent at the University of Pennsylvania, which is where I did both of my residencies. And I also met some people who were neurosurgery residents during his time there. So that's kind of a connection I realized. I didn't really understand when he was doing this what he was doing, but later, retrospectively, that was something that I came to understand. And I came to Columbus when I finished my training. I guess we'll get to that. And I went to the osteopathic hospital, invited me to come and give a talk. And the old-time guys, and they were all guys at the time, asked me, "Are you related to Ray Ruberg?" They all knew him.
Wow.
So then they kept, that was a great introduction for me. Somebody related to this guy who was really prominent in the osteopathic sort of branch of surgery.
Yes. Okay. Great. Your wife, how did you meet her?
My wife is Cynthia Leaf Ruberg. She always tells people that we met in a mouse colony at Wyeth Laboratories. And that is indeed true, that I was working as during my summers in college, and then I think maybe even 1 year in medical school at Wyeth Labs, which was in a virology section of Wyeth, producing vaccines and so forth. And my wife's mother, who was a very prominent microbiologist and virologist, arranged for her to have a summer job in the same place. And so we met. She was doing something in a mouse laboratory, and that's when we met.
Okay. we're going to talk a little bit about Ohio State, and where you're a senior advisor and chair to the departments of plastic surgery and urology, not practicing now, more administrative. But I want to know why you picked plastic surgery. And then we can get to the other and tell us about your mentors, if you would,
Okay.
while we're on the subject.
I picked plastic surgery probably for not the right reasons. I'm not sure that I decided I liked surgery. Now, one of my problems when I was going through medical school is I remember that with every clinical rotation, all my friends would say how excited they were about this and this and this. And everyone I went through every rotation, I didn't like this, I didn't like that. I thought orthopedic, and I didn't like those. I didn't like anything. My last rotation was surgery. And I said, if I don't like this, I don't know what I'm going to do. But I did like that. And then I began to figure out, I don't know if this whole big category of practice of general surgery is what I want to do. And I was interested in genetics, and I was interested in congenital anomalies. And so I started leaning towards plastic surgery. I took a rotation as a medical student with one of the icons in plastic surgery, Bradford Cannon. And I really, at that point, recognized that's what I wanted to do.
And that was up at Mass General.
That was at the Mass General. And I remember the first time I really said anything, I was going for my internship interview, and at the University of Pennsylvania, it was one of the places I was interested in going. And at that point, I said, well, you have any specialty interest? And I said, plastic surgery. So I sort of made at that point, that was the direction I was going. And I'm delighted that I did that. I think it was just right for me. And it's proved to be that way for all these years since that time.
I asked this question to everybody, what's your interest in plastic surgery? Of course, I'm talking icons, so their interest is blossomed. They're having a seat here talking to me. That's how far they've gone. I've met very few plastic surgeons, but I've met some that really didn't want to do plastic surgery. I think they went in it for the wrong reasons, because not everybody picks it. But as far as I'm concerned, it's the greatest medical profession there is. It's the most fun, it's the most innovative, et cetera. But you know that. I'm not telling you anything you don't know.
But at the time, I don't know that I recognized all of that. Now, in retrospect, that's why I say it was just the right thing for me, because of so many different things that you can do. And we'll get to that.
Remind me when this is over, I'll tell you the story how I went into plastic surgery. Okay. They're nobody's interested in that story here, but I'll tell you.
Is that in Icons 2? It's coming in the next edition?
Someday somebody will interview me, or I'll interview myself. Now with digital, I can interview myself.
Yeah.
You see momentous shifts in plastic surgery during your illustrious career. Tell us just a little bit about what you've seen and things that affected you the most.
Not necessarily things that affected me, but maybe affected the specialty. But I finished training in 1975, and it was at that point where really 3 major innovations in plastic surgery care and surgical care, in patient care, came about that enormously influenced the specialty and gave us all the different directions that we could go. And I'm sure other people have talked about the same thing, but just about that time, microsurgery was put on the map, and then craniofacial surgery. And I had the, I think, unique experience when I was a resident in scrubbing on cases with Paul Tessier. And
his name's come up every single interview.
And then liposuction, which was a major innovation in aesthetic surgery. And all these things happened at around the same time, and it just made plastic surgery into so much more of a specialty than what it used to be.
And breast reconstruction.
Right, but then that's including, so that's using micro techniques, so it's got some of these other things as well. So there were just a lot of things that made this specialty so exciting. And I think that's what still is there today. I mean, we have other areas now that people are moving into, but the specialty is always inventing the future. And that's kind of what I think has made it unique. And it's also what makes it difficult for people to understand what plastic surgery really is.
Right.
Because there's something that our people today are going to be doing in 10 years that nobody's thought of.
We're going to get into that in a second.
Okay.
It's going to be 25. So you put that thinking cap on when I'll ask that question. We finished at the same time. And I tell a story up in Ohio. We did our first breast reconstruction because in the old days, everybody did a radical mastectomy.
Right.
So the skin was as thin
Right.
as this flower. Then you put an implant under there. That was a disaster waiting to happen. As we know, the implants weren't that well designed, as it were. And we did a latissimus dorsi flap.
Yes.
And we delayed it. That's how little we knew.
Yeah.
You know, delayed it 2 weeks and brought it around. Looked terrible, but I'm sure it was, you know, refined. Because the bad thing about a residency, you don't get long-term follow-up.
Right.
This was 6 months before I left. I never got to see the final result.
Correct.
But I'm reminded of the story they got in the 20s. They say, we should close the patent office down. We don't have anything else to invent.
Right. Well,
Don't close plastic surgery down. We've always got something to invent.
right. And that's what's so exciting about. That's what's, I think, unique. I mean, every specialty, I'm sure, has innovative things. But, I mean, taking something like microsurgery just changed enormously how things could be done.
Patent is a paradigm shift.
Right. So these are all of those techniques, or the introduction of those methods of treatment, resulted in paradigm shifts in the specialty, and you can anticipate something like that's going to happen again in 5 or 10 years for plastic surgery.
In the field of plastic surgery, what do you think the greatest mistake that we've made as a group in plastic surgery?
I think it's a political mistake that we made, and it's not recognizing that there were other people who had the skills to do certain parts of aesthetic surgery, particularly the facial plastic surgeons.
Yeah.
And I was around and just beginning to practice in the time when there were lots of battles over turf and territory. And plastic surgery was not, the mainstream of plastic surgery was not ready to accept some of these practitioners from other disciplines who had all the skills that were required to be the same quality of care that plastic surgeons had. These people were excluded from the mainstream of plastic surgery organizations, and we have great turf wars going on still. And so I think that was a mistake. I don't know, I think that it was sort of a corporate mistake on the part of plastic surgery, but it was protecting their territory instead of welcoming other people into the discipline. I think that would have maybe made the discipline better, and it would have made for more coordinated care of lots of problems. So that was a political mistake that the specialty made.
Well, I can tell you of the interviews I've done, these are the 5 I've done that so far. Let's see, I have 7, 6 I've done here. Every single one, that's what their opinion was. And you're right, it was a turf battle that didn't make a lot of sense, ended up in litigation, as you remember,
Yes.
and costing us money. And I agree with you. The ENT are board, they're American board. You know, they're certified by the American Board of Specialties. They are a specialty, and we're a specialty, and we were trying to carve out for us, because as you know, in the 70s, plastic surgery used to be something nobody talked about. And then today, everybody talks.
Right.
They show you pictures of their breast augment
Yes.
during the case. Not just before, but during. So it's a different age. And we're going to get into some about what you think in the future. But tell me who you admire most, professionally or personally.
There were a number of people during my general surgery training that taught me things about how to treat residents, how to conduct decent educational programs. But the person that had the greatest influence on me was my predecessor as chief of plastic surgery at Ohio State. That was Ron Berggren. And Ron is one of the icons of plastic surgery. Ron had been the chief. This was a man that came out of his residency and was hired by Dr. Robert Zollinger to be the chief of plastic surgery at Ohio State right out of training. And 10 years later, I came to work for him. And I learned how to run a program. I learned how to be an educator. I learned how to treat people, how to create an atmosphere under which everyone was comfortable and happy working. And so he was really my mentor. And when anything's come up, people say, well, why do you do things this way? I said, but I learned that from him. And one of the things that was not usually focused upon in practice, especially when you and I were finishing training, I took the job and bought a house, moved into town, and my first day of working, he said, okay, here's how we run the year. We meet like we are right now in the summer, and we have our own schedules, and our kids' school and all this other schedules, and we put those together and we figure out how we can cover all the other things that we need to do in plastic surgery, and there were 2 of us at Ohio State, and we work it all around all of this. So all of this is just as important, and we just figure out how to make that all happen. And I've kept that as the fundamental theme of what we do at Ohio State. We're no more 2 people. So I said to the new chair, whom I call my boss now, Amy Moore, when I came, there were 2 people, and we have 10 times as many faculty. So we do have 20 faculty members.
Yeah.
But I try to keep that same family in the environment in which we work. And so that was my mentor. That was the man who, more than anything, showed me how to do all these other things. Not so much the technical aspects. Now, he could do almost any kind of surgery, but it was how to deal with people, deal with the administrative environment, and create an educational program that helped to foster the future of physicians in general and plastic surgeons in particular.
Yeah, and correct me if I'm wrong, because you'd be the perfect guy to ask. It seems like, and I trained up in Akron, that Ohio State has tried to involve other programs. Am I right or wrong as far as relationship or some?
Oh, yeah, I think there's an Ohio Valley Society, but we've also tried to do some things cooperatively in the state. Now, that's not always so easy to do, but that's been kind of our atmosphere is, come on, we'll do this together, and whatever it is.
Well, see, that's a step taken that we didn't take with ear, nose, and throat.
Right.
So, look, we're here in Ohio. Why not bring these programs in, exchange? I would have loved that. Somebody said, hey, you're going to go to Columbus for a week, or you're going to go here, or you're going to go there, because the whole is greater than the sum of its parts. Every bit of exposure you get makes you a better surgeon.
Someone had established, and we've really promoted, a Tri-State Craniofacial Association. It's not really an official entity, but the programs in Columbus, I think we tried to involve Northern Ohio, certainly Cincinnati, Indiana, Kentucky.
Right.
And we would have these regular interchanges, regular sessions. And so for me, cooperating, working together with people is much better than fighting with people. So,
well, you think that would work politically?
Yeah.
Does it?
Well,
yeah.
Well,
but we're working for the greater good, which is our patients' care.
That's it.
So
that's what we're all about.
Tell me a little bit about the book you have written that was a core curriculum, and you mentioned about how it's not as pertinent now, and because of digital stuff. But I'd be interested because we discussed when we trained Grab and Smith. Right. And Converse's stuff, that was the Bibles of plastic surgery as far as basic plastic surgery. But tell me what you wrote and the purpose.
This came out of what I think, and we may get to that because I think that's one of the things that you're going to want to ask about, is what's the most important thing I did for plastic surgery.
I'll just ask it.
Okay. I didn't personally, but I led the effort to develop the first curriculum for plastic surgery residencies. And I think that, several very prominent people had been in charge of doing this. I won't mention their names, but I can think of who they were. And they said, it's impossible. You can't get all the programs to agree on what plastic surgery is and what it should be. And at that point, I was a really brand new program director. So we're about 1985. And so the old-time guy said, this can't be done. And whoever was the president of ACAPS, whatever, it had a different name at that time, but the same acronym, said, well, just give it to this young guy. We'll let him see if he can do this. And so that was my challenge. Yeah.
Wow.
Okay, I'm going to do that. And with a committee that worked very hard, we created the first curriculum in plastic surgery. We encompassed the field, and we had then what are the things that individuals need to do, and there were essential, optional, and there were it was mandatory, required, and then optional things in the curriculum. Like, you don't have to do this or this, but you have to learn how to do this, some sort of technique for reconstruction using flaps or something like that. So we created the curriculum, and then actually it was Dave Smith, I think, who came to me and said, can we use your curriculum to do a textbook? Why don't we fill in all the details in each of that? We just take the curriculum as our outline, and we'll get people to write chapters on all the different details. And that's how the book came about. And so it was intended to be sort of the basic knowledge of what is in plastic surgery. It was used a lot for a number of years. It never was updated, so it's certainly obsolete now, except that I think that the concept of what plastic surgery is and what the outline of the curriculum is still valid for what it
it's just morphed into a more modern day.
Right.
And when you were talking, I was thinking, we talked about my time in Houston, and there was no coordinated program. And then you go up to Akron. I literally, the weather changed a lot.
Yeah.
It was 70 degrees in Houston. Next day I was in Akron, it was 25.
Yeah.
Moved my family. But I'll tell you, the wonderful thing about the program and what Jim Smith did, which was from his training in Pittsburgh, and what we had a journal club.
Yeah.
We had, whenever you went and do a case, they say, okay, now he's going to ask you where the anterior belly of the digastric inserts. Then he's going to ask you where the nerves, and this was the curriculum that we had that I didn't have. I had the benefit of seeing the good and the bad. And it's nothing about the program. Now it's a great program, but it was a new one there. But for me, I was hungry to learn everything that I could.
So at that time, what was your plastic surgery program? Every program did what it thought was right for plastic surgery.
Exactly.
And the whole intent of this effort,
it was like herding cats.
Right, it was spearheaded by ACAPS, was to say there should be a certain essence of what plastic surgery is, and if we're going to, for example, verify that a program has the patients, the instructors, the knowledge to create a fully formed plastic surgeon, we ought to be able to define what all those elements are, and they need to be standard all over all the programs. So I think that's why I think that's my biggest contribution. I still have some of the original materials, the first published paper curriculum, of course, because it wasn't done online very much at that time at all. But it's standardized what should be in plastic surgeon, in a plastic surgeon's training, and I think it changed how education went forward in plastic surgery after having that.
Right. Well, that's important. You to have a standard. Let's see. Oh, your words. Are you retired right now? Are you still practicing? We talked about this.
Yeah. But technically I am retired, but I'm a returning retiree at Ohio State. Ohio State allows you to retire and get your pension and then come back to work, sort of at much less salary, with less responsibilities for a period of time as a returning retiree. So I'm working as a returning retiree. I've not done surgery in probably 12 years, but I work as an educator and an administrator. I think you read my title as Senior Advisor to the Chair of Plastic Surgery and of Urology. And basically I help with promotion and tenure issues, educational aspects. I write policies for programs. And I'm employed now, but if we did this interview in 3 months, my employment would have terminated. However, my involvement will not.
Okay, so essentially, it's your vocation now. It will become an avocation in a sense, and you'll fill the time with other interests that you have.
Exactly right.
Okay. Well, what do you have prediction for plastic surgery in the next quarter century? I told you we'd come back to that.
Well, we're going to do all the things that we're doing now. Something new is going to come along that we're going to do, and I don't know what it is, but it's going to be just like all these other things, tissue engineering and so forth. So plastic surgery is going to be different, and there's going to be some focus that we haven't seen before. So I'm predicting that I don't know the answer. I'm predicting I don't know what's going to come, but I don't think it's going to be the same as it is now. Because if it is the same as it is now, a lot of other specialties are going to move ahead of us in terms of things. So we're going to invent things that, in fact, other specialties choose to use eventually. Now, we didn't really invent myocutaneous flaps, but certainly putting it on the map was plastic surgery with McCraw and Arnold. I don't know if they were the first authors of using the gracilis myocutaneous flap for vaginal reconstruction.
I can't remember the second author either.
But that just, that changed how so many things were done with that principle of using muscle and musculocutaneous or myocutaneous flaps for reconstruction. And I think something else in that line, which I can't envision, is going to come along, and the specialty will be the leaders again, and other people will follow along and say, oh, these people, no longer guys, these people is the right term, have created all this new knowledge, and we can now apply it to our discipline and utilize what plastic surgery has created, which is what we've done with craniofacial surgery and with microsurgery and with liposuction, things that that changed enormously how people did things, and other people began doing the same thing. We'll come up with something again new, or then we may not be valid as a specialty if we don't have something again where we can lead ahead of everybody else in something that helps in patient care.
Well, not off topic, but a question that came up this year that we wouldn't have come up before that. How did COVID affect your life? In January 2021, I believe, was the first COVID case. I wrote it, of 2020 was the first COVID case.
It affected the practice at Ohio State enormously in terms of clinical care. It didn't affect me as much as it in my professional life, because I could do all the things that I was doing from my home. When conferences went virtual, I was still there participating in the conferences. When I used to have meetings regularly with the chairs whom I served. So those meetings were online, and I could still write and create policies and so forth and exchange them electronically. So in my own behavior, except for how I functioned as a old person trying to avoid this disease, but my professional life didn't change that much. It did for the practice of my colleagues, because obviously it had enormous impact on how they practiced and how the department generated revenue to afford the faculty members and the associated personnel. So that was an enormous influence on the practice that my colleagues were undertaking, but not so much on me, because I was already in this, as I said, returning retiree, only working this as a 0.25 FTE, so I'm working a day and a half a week. And doing that from home just meant I didn't travel as much. My car has many fewer miles on it, but I could do the same things in my environment of what my world was, but my colleagues were.
All right, so you adjusted.
Yes, yes. And so it had no adverse effect or minimal adverse effect, whereas it did on the people who were practicing and doing surgery.
And I think I asked you, if I didn't, because I've done a number of these interviews, about any words of wisdom to present residents in plastic surgery ready to going into practice, and any final thoughts you might have.
And I guess that's something I hadn't thought about a lot. I think coming out of the program as I described it at Ohio State, I think that our people should go into this world to be able to create the same kind of atmosphere in which they practice. When I was the president of the association, my presidential speech was on lifelong learning. But it wasn't really lifelong learning, and the theme of my entire life was lifelong teaching as well.
Okay.
And that I see that as a role of a plastic surgeon, even though maybe you're not in an academic environment. You still are teaching your patients. You're teaching them about the processes that you're going to be doing. You're teaching them about complications. So you're not just laying it out there and just you really need to be able to make that educational connection. And that's what I would appeal to my graduating residents to say. Remember, you're a lifelong learner. The medical school teaches you that, but you're a lifelong teacher as well, and be good at that. That's
a great way to put it. And my final thought with what you just said is, when I first started out in practice, I would talk myself through a case as if I was teaching it. In reality, I was just releasing the anxiety I talked to Dr. Kawabota. I said, that first big case I did, I looked to my right, I looked to my left. There was no attending. I thought, time to go to work.
Yes.
So Anyway, thank you so much. It's been a pleasure to interview you, Dr. Ruberg.
Pleasure to meet you
Yes.
and to hear your story as well.
Thank
as
you
we
so
talk.
much. Okay, that will be the end of our interview.